Good morning, everyone, and thank you for watching the City of Janesville COVID-19 Community Briefing for April 17th. This briefing is provided Monday through Friday at 8:30 a.m. My name is Dwayne Cherrick, and I am the Planning Section Chief for today's operational period. We'll begin this morning with information provided by one of our community partners, Chief Executive Officer for HealthNet of Rock County, Ian Hedges.
Thank you so much. My name is Ian Hedges, and I'm the CEO for HealthNet of Rock County. This virus is unlike anything that we have seen before. And as being in public health for about 15 years, what I can tell you is that it's just like any other health problem that we experience, which is that unfortunately, the greater the sacrifices we make, the bigger the payoff in the future. And that's what I say. It's the same thing as dieting. The more discipline you put into it, the more sacrifices, the greater the payoff is going to be at the end. And that's going to be the same thing with COVID-19. The more sacrifice and discipline that we put into this, the more that we are going to see social distancing restrictions being put on less on the community, hopefully a stay-at-home order, end sooner rather than later, and that we can go back to our lives as normal. One of the things I would like to share with you, the thing that we are seeing the biggest issue of is obviously many former employees of companies and small businesses in town right now who have had to be let go because of the current economic climate and because of the restrictions put on businesses. There are many individuals right now who are just trying to stay at home, abide by those restrictions, but they are without health insurance right now because they've lost it due to the current climate. So the recommendation that we're trying to make to the community right now is if you are without health insurance and you believe that you will qualify for Badger Care because of the loss of this job, please go to access.wisconsin.gov/access. Right now, apply for Badger Care/Medicaid, because if something were to happen to you, hopefully you would not be stuck with a bill that you could not pay for in a healthcare scenario or emergency. But most importantly, you can take care of your health and get access to the medications you need during this time, because what we have seen is with COVID-19 is the healthier you are as a person, the least likely chance you are to get it. So please kind of remember that. However, some individuals right now might have not been let go from work, but their hours have been significantly reduced. Their income isn't what it was before. The other issue too is that many individuals might not have had a job or might have not realized that there was a free clinic in town. HealthNet of Rock County is a free and charitable clinic that provides emergency medical, dental, and behavioral health services to those who are low income and uninsured. And during the COVID-19 epidemic, what we are doing right now is we are still continuing services up until this is over, because the health of our patients is priority in order to reduce the level of transmission. As of now, what we are doing is we are providing curbside medication pickup. For those of you who don't know, we are a medication dispensary repository for those who are uninsured. So anybody who doesn't qualify for Medicaid, doesn't have any insurance source, but still needs access to medications, can come to us with their prescriptions, and we can fill them as long as they're not a controlled substance. The other thing that we are also engaging in right now is we are doing emergency dental visits. We really are trying to encourage folks not to go to the emergency room if they have emergency dental pain right now, because we have to free up the resources of our emergency rooms during this pandemic. So if you have an urgent dental problem, please give us a call at 608-314-1940. If you're uninsured, if you're on Badger Care, in this case, if you're on Badger Care, call us and our dental offices will be able to schedule you within the next couple weeks or sooner than that in order to make sure that you can get a dental appointment to have your emergency dental problems taken care of. We are, starting next Monday, going to be doing virtual enrollments, meaning that if you need services at our clinic in the future, but also if you're a new patient and haven't been with us before and you need access to those medications, call us at 608-756-4638 at our main number. And what we can do is we can do a quick enrollment with you, get the necessary information, and then also tell you when our medication pickup days are. We are doing curbside drop-off, meaning that you just come through a little drive-through at Doubting Mill Alley in downtown Janesville, and we will just provide you your medications once you're enrolled as a patient with ours. The thing I want to mention, kind of last two around this is please make sure that anybody who is coming out of the jail, a loved one, a friend of yours, and they may or may not have health problems. One of the things that the jail does offer is you have a right to get a voucher from the jail. And if that person has medications that they need filled immediately, again, that person coming out of incarceration is going to have a difficult time in the community to find healthcare resources. But HealthNet of Rock County will give a 30-day supply of their medications that they were receiving in the jail so that you do not have to go out, seek a pharmacy, or have to worry about where you're going to maintain your health for the next 30 days. That can be especially important for somebody's mental health. So please, again, if you have any questions about that, call 608-756-4638. And that applies to anybody who's been recently released from the jail. If you need to go back to the jail and say, listen, please give me that voucher for HealthNet, they will take care of you. Last but not least, please stay healthy. The people that we've seen in this pandemic who are most vulnerable to this are the people who have the least access to services and who are most socially marginalized. And so we just have to make sure that those people are also not forgotten and that they don't fall through the cracks, because that's how we're going to get ultimately to 0 cases in Wisconsin. So please, if you have or want any more information, visit healthnet-rock.org. Thank you.
Thank you, Ian. Next, we'll review our incident objectives for the city's COVID-19 response. First, safeguard the community, including our residents, businesses, and visitors. Second, deter the spread of COVID-19 within our capabilities. Third, provide essential services to the community. And fourth, safeguard City of Janesville employees and preserve our city service power. At this time, we'll now hear from Situation Unit Leader Maggie Dar.
Thank you, Dwayne. Good morning, everyone. I'm Maggie Dar, Situation Unit Leader for this event. First, thank you to Mr. Hedges for being here. That was very good information. So yesterday, Thursday, April 16th, the Wisconsin Department of Health Services reported that there are 3,875 positive confirmed cases of COVID-19 in the state of Wisconsin. There are 63 confirmed cases in Rock County, which is an increase of 1 from my report yesterday. And we have had 4 deaths in Rock County, which is the same as yesterday. We continue to closely monitor our staffing levels, and again, this is to ensure that we can continue to maintain our essential municipal services, so we can continue to respond to fires and EMS calls, calls for police services, public works. We can continue to pick up your trash and recycling. So it's important that we preserve that city workforce power. As of yesterday, we had 48% of our employees working in their assigned work locations. We had 18% working remotely, and 33% of our employees were out either because they were not assigned to duty or because they were out for another reason. We also continue to closely monitor our levels of personal protective equipment, and we are in pretty good shape in that regard. We have no concerns right now about critical infrastructure in the community. And we also yesterday just received some data, some preliminary data on unemployment claims within the last month. And we're using that data to continue helping us plan for the recovery as we continue to face this event. We're also still continuing to keep in close contact with all of our partners, other governmental agencies, nonprofits, schools, medical providers, and more. Thank you this morning.
Thanks, Maggie. Now we'll hear from Economic Development Director Gail Price.
Good morning, Economic Development Director Gail Price. Staff for the Economic Development Office continues to be available to talk about strategies for businesses to get through this pandemic. We're continuing to post information for the various programs for recovery at our growjanesville.com website. If you click at the banner at the top, that will lead you to the page that has those various pieces of information. Most significantly, that's going to be new is additional information regarding the Rock County Emergency Small Business Loan Fund. That portal will go online on the 24th of April. That is specifically focused on much smaller businesses, 20 or fewer employees. Business has to be in operation for at least 12 months. A minimum documented decrease in revenue of at least 25%. And again, we're going to have that link posted to the growjanesville.com website later today. You may have heard that the Paycheck Protection Program is out of funds. I would encourage anyone in the community to contact your congressional representative about refunding that program. There is some discussion about $250 billion being added to that, and so certainly encourage Congress to make that move. The EIDL program through SBA continues to be available. That is an online application. You can go right to the SBA website for that. The SBDC network, so most closely UW-Whitewater at 262-472-1365 is available to help with that. Remind everyone that stimulus money is hitting people's bank accounts right now. If you are going to receive a check, those will start being issued next week. And we're certainly encouraging people to spend local with that money because when you spend local, it does circulate through the economy more and has a longer lasting impact on the economy, which we want to see that positive impact. The Economic Development Office is talking strategies with various businesses about what this looks like at the backside of the recovery and after the safer home mandate is lifted. So certainly encourage business owners to be thinking about what your business practices are going to look like and what can the Economic Development Office do to help facilitate that. Again, contact us at 608-755-3059. Thank you.
Thanks, Gail. Next, we'll hear from Public Information Officer Alan Luckett.
Good morning, Janesville. We'd like to make sure that you direct yourself towards our city's website, which is ci.janesville.wi.us. From there, you can access our Facebook and our Twitter accounts. And also, you can receive email press releases directly to you. So if you go to the website /email list, then we'll add you to our email list as we send it out. COVID-19 information is available also on the top of the website. So if you go there and click at the top, you can get our resources, our community resources, our archived briefings, frequently asked questions, CDC information, business recovery information, and much more. The City of Janesville also trusts many government-related sanctioned sites such as the CDC, Wisconsin, Department of Health Services, FEMA, and others. If you have any questions, please contact our city's community support hotline. It's open daily from 8 a.m. to 4 p.m., and that number is 608-373-6027. Please share this information with your family, friends, community groups, through social networking as well, to anybody that you think could benefit from it. And also, if you happen to have a Twitter account, we're doing a hashtag One Positive Thing and hashtag Janesville Strong to help support our community. Thank you.
Thanks, Alan. Next, we'll hear from Finance and Administration Section Chief Tara Semenchuk.
Good morning, Tara Semenchuk, Finance and Administration Section Chief. The EOC response team has logged 4,501 hours to date. we have captured expenditures of $832,279.11. The EOC Admin Finance section is documenting all personnel and operating expenses related to the city's COVID-19 pandemic response for potential reimbursement from the Federal Emergency Management Agency's Public Assistance Program. The FEMA PA program reimburses 75% of eligible assistance expenses, while the state has agreed to reimburse 12.5% of eligible assistance expenses. Thank you.
Thank you, Tara. Next is Safety Officer John McManus.
Good morning, Captain John McManus, Safety Unit. We would like to continue to emphasize washing your hands for at least 20 seconds repeatedly, especially after you've been in a public place. In addition, that 20-second wash time is what allows soap and water to break apart any viruses that are on your hands. And just a little bit reminder, because we've all been washing our hands quite a bit lately, that water temperature should be comfortable. It does not need to be hot. It could even be cold. It's really the agitation for 20 seconds that lets those viruses get broken apart. If soap and water isn't available, please use hand sanitizer with at least a 60% alcohol content, and avoid touching your eyes, nose, and mouth with unwashed hands whenever possible. We should still continue to avoid close contact with people who are sick and create a space between each other of at least 6 feet when we're outside our homes. Formulate a plan if someone in your household becomes sick. When you wear a non-standard fabric mask or any other mask in public, it is very important that we continue to maintain this 6-foot social distancing. The CDC is currently recommending the wearing of cloth face coverings in public settings where other social distancing measures are difficult to maintain, like the grocery store. The CDC is also advising the use of simple cloth masks to slow the spread of the virus and to help people who may have the virus but don't know it from transmitting it to others. The cloth face coverings recommended are not surgical masks or N95 masks or N95 respirators. Those are critical supplies that are needed for medical professionals and should be reserved for them. Workspaces and residences should continue to be cleaned daily with EPA-approved cleaners, and high-touch surfaces in your area should be cleaned with a higher frequency. Thank you.
Thanks, John. Now we'll hear from Incident Commander Chief Ernie Rhodes.
Hi, good morning. I just want to emphasize the safer at home. Last night, the fire department had 2 fires stacked on top of each other, and on my way back from the fires, I was driving through a neighborhood, and I noticed about 8 people in the front yard together, laughing and very close to each other, and it looked like a small party. You've got to stop that. You've got to stop that. As an incident commander, as a tactical fire officer, I can control a lot of resources. I have a very aggressive fire. I can assign engine companies, ladder companies, ambulance companies, and I can put it out. If there's a chemical emergency and there's a leak, I have a hazmat team. One of the biggest resources that I have in this city as an incident commander is you. I need you to stop doing small parties, to practice your social distancing. I need you to wear your face mask. You've got to wear your face mask. Here's why. 1 in 4 patients that have COVID may not have any signs or symptoms. And so you could be a carrier. And you could also have the infection and be contagious for days before you're symptomatic, before you have shortness of breath, before you have a fever, all right? And you're not knowing it. So if you're in public and you're not wearing your mask, you are aerosolizing the infection, you are putting it in the environment for people around you. So the mask will not actually protect you, but it will keep the infection in you. And if we all wear our mask, we can naturally decrease the spread, the threat to the environment, that we could inhale the contagion, and we could continue to flatten the curve. Please, please have compassion. when you go to the store. If you look at our retail workers, they're all stocking the shelves. They're checking you out. When I go to the store, I see many of our citizens not wearing face masks. And these retailers are sitting there exposed. They have a high frequency of people going through their lines or walking through the store. Please have compassion on each other and respect for each other and wear your simple face mask. If you don't have a mask, wear a bandana. If you need to learn how to make a mask, go to our website. Go to the City of Janesville website, the green ribbon up top, click on it, go midway, CDC's recommendations for face masks, and the Surgeon General will show you how to make a face mask. I implore you to wear your face mask. Remember, the signs and symptoms are fever, cough, and shortness of breath. If you think you have COVID or you're concerned, you once again go to our website in the City of Janesville, the green ribbon, click on that and go to the mid-page and click on Health Assessment. And you can find Department of Health Services. Do you think you need a doctor? Click on that. It'll take you to a website from the state health agency, and you can fill out or you can connect with a health practitioner to identify if you need medical care. I urge you to do that. Take advantage of those resources. Let's talk about this weekend. It's Friday. We're going to have a great weekend. You're in this, you're becoming resilient, you're learning how to let go of things you can't control. Hopefully you're eating good, you're getting good sleep, you're exercising, you're meditating, you're in prayer. Do one positive thing. Do one positive thing and reflect on that every night. It will get you through this. Folks, I really appreciate your cooperation. I'm really proud of the City of Janesville team. And for those that are social distancing and wearing their face masks, keep doing it. Keep doing it. I thank you. And give each other grace. Thank you.
Thank you, Chief. Now we'll hear from Janesville City Manager Mark Freitag.
Thank you, Dwayne, and good morning, City of Janesville employees, certainly our EOC members and members of the community that are listening into this briefing. I'm going to double tap on what Chief just shared with you, and that is, as a community, we got to start wearing our masks. That's going to be one of the ways that we prevent this from continuing to spread. So what my message is that if you care about your employees, if you care about your customers, if you care about this community and you love this community, then when you're in a public setting, put a mask on. As Chief said, you're not going to help yourself, but you're going to help all those around you because you're not going to be spreading whatever you might have to them. And so again, the message is if you love this community and you want to beat this thing, then let's start wearing masks. And so I would encourage community groups, public service organizations, friends groups, you name it. If you're an agency out there, an organization out there in the community, and you're looking for a way to impact COVID-19 in our community, then I would encourage you to make masks, to buy masks, to distribute masks, and the EOC team, the City of Janesville team, is working today on what is a collection plan for those masks and what is a distribution plan for those masks. But folks, this is a simple way to get ahead of COVID-19 and the spread in our community. And so again, if you love the community, then do the right thing and put a mask on. I go around town, I see lots of folks out there. Employees are not wearing masks. They're interacting with customers who aren't wearing masks. And that just isn't the right thing to do in this environment. So get a mask on. No one hates wearing this mask more than I do. Trust me, I don't like it at all. But I wear it because I love my employees. I love this community. Folks, I would tell you that it's supposed to be a nice weekend. Enjoy the weekend. Get out, exercise, breathe some fresh air. If you have contact with the public, wear your mask. But take the stress level down a little bit and enjoy the weekend and come back refreshed on Monday for another busy week. But we're wrapping up 5 weeks in the EOC. The City of Janesville team continues to provide and plan ahead, provide for the community and plan ahead of where we're going next. Recovery certainly is a big concern for us and what that looks like. But we're here for you. You're in good hands. Again, as a community, we're going to stand tall, stand firm, stand together. We are Janesville strong.
Thank you, Mark. This has been the City of Janesville COVID-19 Community Briefing for April 17th. The community briefing is provided Monday through Friday at 8:30 a.m. Please continue to be safe and stay healthy this weekend. Thank you for watching.